Hi, everyone, and welcome to the Rural Doc Allen podcast. I'm excited to welcome to the program Rural Doc Allen Lindeman. Doc, what's going on, man? How are you?
We're doing well here, Neil. And you?
Fantastic. And today's topic, management of postpartum bleeding. Is postpartum bleeding common?
Well, in the United States, it's the second most common cause of maternal mortality, about 14%. So yes, it is fairly common.
What is the most common cause of pregnancy-associated bleeding?
Well, mostly that's something we call uterine atony, or a soft, boggy uterus that doesn't contract. And see, it's a contraction of the uterus that shuts off the arteries that cause the bleeding. So they have to contract.
Is postpartum bleeding preventable?
I think it is. There's, as far as I'm concerned, there should be no maternal deaths from postpartum bleeding in this country. We should have, certainly blood should be available, and there are other things that are available too for the treatment of postpartum bleeding.
What are the most common treatments to manage or control postpartum bleeding?
Well, there are several things, Neil, and the first one would be Pitocin. That's what most people would use, and that's usually put in a bag of normal saline, so it's dilute and it's IV. Methogen is another repair or method of using to cause the uterus to contract. That's very old. It's been around for 100 years or more, and it's usually given IM, although some of the older doctors used to give it IV. Today, we have revisited packing of the uterus. Years ago, we decided that was about 50 years ago, that packing of the uterus with material like gauze or towels was considered effective or not very effective, and also a cause of infection. But today we have something called a balloon. So that balloon goes in the uterus, and the pressure of the balloon against the vessels is supposed to shut off the bleeding. I think it's another waste of time. I think it's a waste of money, and it's one more way for these companies that manufacture the balloons to make money. But there's also something called prostaglandins. We've talked about that before. They can be given IM mostly. And then, of course, there's my favorite, fundal massage. So, yeah, we've talked about that before.
So how do you do a fundal massage?
Well, the fundus is the top part of the uterus, and after delivery, you can usually feel that through the belly button, because that's where the abdomen is the thinnest, is by the belly button. And there's a spot about 2 inches across. Make a circle with your index finger and your middle finger of your dominant hand, and a circle. You make a circle there, and the uterus contracts very well. And one time I had to do fundal massage for 8 hours, but I've never had a patient, like I said, bleed to death, and very few have needed a blood transfusion or anything else.
Do you think there are any unavoidable causes or reasons for bleeding to death in the United States?
Well, I would say that there is, every single one of these should not occur, because we have many different ways of dealing with postpartum hemorrhage. We have all of these ways to make the uterus contract. Sometimes postpartum hemorrhage, though, is from surgical causes like an episiotomy or a cesarean section. But for the most part, you can give, there's blood available in most hospitals. You can always give O negative, which is the universal donor. And of course, there's lactated ringers, and there's tranexamic acid. All of those will increase the blood volume so that you have restoration of normal blood volume.
Do you think there are any unavoidable causes or reasons for bleeding to death in the United States?
No, I don't think so. I think that every single one of those should be avoidable.
All right. Best place to go is worlddocallen.com and safepregnancy.com. Thanks, Doc.
Thanks, Neil.
All right. That was the World Doc Allen podcast. Guys, take care.